When people talk about infertility or the couple goes to a doctor, the usual suspect is often the woman, and the man probably receives no empathy or care. However, due to multiple factors, infertility due to the man is becoming more frequent. It's coupled with stigma and negative implications for men in society, as if that wasn't enough, it's often expensive to get treatment for it, even though it often fails. Hello, fellow seekers, welcome back to the channel. If you are new here, my name is Yakub. I'm a holistic practitioner in all the 14 dimensions of health and wellness. Today, we are tackling the silent epidemic of infertility, especially male infertility. The World Health Organization defines infertility as follows. Infertility is a disease of the reproductive system defined by the failure to achieve clinical pregnancy after 12 months or a year or more of irregular unprotected sexual intercourse where there is no other reason, such as breastfeeding or postpartum amenorrhea or the lack of menstruation after women give birth. Primary infertility is infertility in a couple who have never had a child, while secondary infertility is failure to conceive following a previous pregnancy. Male infertility is responsible for 20 to 30% of infertility cases, while 20 to 35% are due to female infertility, and the remaining 25 to 40% are due to combined problems in both parties, while 10 to 20% of cases no cause is found. The male infertility crisis is an increase in male infertility since the mid-1970s. Sperm counts had declined by up to 52.4% between 1973 and 2011. It has impacted some regions more than others like Japan, South Korea, Italy, Sweden, and many countries in the Northern Hemisphere, which are facing a potential population collapse. Infertility has dire consequences on families, especially men, in case they are the sole responsible for it, including depression, addiction, weight gain, social stigma with isolation, marital fights, infidelity, and even divorces. These issues can lead men not to look for help. Male infertility is commonly due to deficiencies in the semen count, ideally of 16 million sperm per millimeter, and the semen quality, which is like the shape and the ability to swim forward for the sperm. Different factors have been blamed for it. However, historically, male infertility was not diagnosed or investigated due to social belief that all infertility is due to the woman, which led to more shame and stigma on the women, at the same time more abandonment and lack of consideration for the men. Varicocele is a condition in which there is an enlargement of the blood vessels, especially the veins, in the testicles, which lead to abnormal sperm or no sperms at all. It's the cause of infertility for 40% of the male infertility. Thankfully, it's reversible with the surgery and has high rate of regained fertility, especially if done early. Smoking tobacco has been proven to cause infertility. Tobacco damages testicles, kills sperm, prevents the production of sperms, and even predisposes to a varicocele. Genetical conditions, mainly Klinefelter syndrome, which men who have 47XXY instead of 46XXY, is found in 1 out of 500 men. And it can go up to 2 in 1,000 men. And it's one of the leading causes of permanent infertility due to the lack of sperm production from the testicles. It's common with sons of fathers who were older than 35 years when they gave birth, and so you can see the age leads to deformed sperms, and reduced fertility in men also. Another condition is Y chromosome deletion, whereby the man has no Y chromosome at all. As you remember your biology, men have X and Y, while women have two X's, and they both combine to 46. So 32 from the mother, 32 from the father. So for the Klinefelter, they have an additional chromosome from the mother, which gives them 47, while for these people who lack Y chromosome, 45X. Issues to do with erectile dysfunction, taking chemicals to gain muscles, steroids, some medications like antidepressants and anti-ulcers, abnormalities in male genital organs like undescended testicles, infections like mumps and malaria, trauma to the testes, and testicular cancer have all been linked with male infertility. Environmental factors like phthalates, which is a chemical found in plastics, has been shown to predispose to abnormal formation of the male genitals in babies. The anogenital distance is reduced in those babies who also display preference for girl toys, so they are more feminine. Also, estrogen-like chemicals, which is found in a lot of female cosmetic products like creams and perfumes, also lead to abnormal formation of the male genitals in babies. Other chemicals which have been linked are pesticides, substances which is found in receipts and cans, which can all impact hormones in men, though rather temporarily. Lastly, heat can lead to death of the sperms and abnormally shaped sperm. That's why the testicles are outside the body, because of the lower temperature needed for its production. So things which lead to overheating of testicles can predispose to infertility. Often the cause might be due to both male and the female, which will require caring for both through procedures like using the sperm for intrauterine insemination, which is releasing a healthy sperm in the uterus with a device, in vitro fertilization, the common IVF, which is extracting sperm and the egg and fertilizing them in a glass after taking hormonal injections to boost both sperm and egg production, or IVF with intracytoplasmic sperm injection, which is the injection of the sperm directly to the egg. Unfortunately, most of these procedures do not guarantee 100% success, with varying degrees due to factors like age, the severity of the cause, and the technique of the procedure, resulting in multiple trials before success. They often come with a lot of stress, stigma, and expenses which can range from $4,000 to $10,000. As a man, there are a couple of things you can do to avoid infertility, like avoiding smoking, excess alcohol, and drugs like marijuana, losing weight since obesity is linked with infertility, not taking chemicals like protein shakes and testosterone to gain weight, avoiding activities which lead to overheating of the testes like putting on fit boxer, not driving for too long, avoiding putting your laptop on your lap, and not going for sauna or hot tubs. Not meddling in pornography and vigorous masturbation, which can both lead to erectile dysfunction. Avoiding chemicals which contain harmful substances, the ones which we have aforementioned, like phthalates, estrogen-like pesticides, and so many more chemicals out there which can harm your future fertility. Taking a genetic or sometimes a hormonal screening to rule out genetic conditions, mainly the 47XXY. Taking vitamin E and zinc, which reduce the damage to sperm. At the same time, avoiding processed food and soda. Preferably having children for the age of 35. As we mentioned, age can both reduce fertility, at the same time can predispose to abnormal sperms, just like Klinefelter syndrome in the babies. And lastly, wearing a protective cap or a chalk strip in case of playing dangerous sports, which can predispose you to a trauma on the testicles. Currently, with your health, work, education, finances, relationships, parenthood, or life in general, if yes, please feel free to talk to us in an effort to find a solution based on our expertise and experience in counseling and coaching together. Book a free 30-minute consultation by clicking on the link below. Thank you.